Welcome to BCBA Exam Prep, Section 1, Personnel Supervision and Management. This section focuses on how BCBAs supervise staff, manage performance systems, and make data-based supervision decisions. If you're preparing for the 6th edition exam, this domain is critical because it tests whether you can think like a supervisor, not just a clinician. By the end of this video, you'll have a clear framework for answering Section 1 questions with confidence. To win Section 1 questions, the first rule is to think like a supervisor, not a therapist. These questions are not about treating client behavior directly. They're about managing staff performance and implementation. Always focus on staff behavior. Use data to guide supervision and match your strategy to the specific performance problem. On the exam, supervision is simply behavior analysis applied to staff. Section 1 covers supervision as a system-level intervention. It includes the benefits of supervision, supervisory relationships, equity, goal selection, performance management, function-based supervision, and evaluation of outcomes. The big idea here is that supervisor behavior influences staff behavior, and staff behavior ultimately affects client outcomes. Behavior-Analytic supervision improves treatment integrity by ensuring staff follow evidence-based procedures correctly. It creates consistent staff performance across team members and leads to better client outcomes. Effective supervision also reduces burnout by providing structure, feedback, and support. On the exam, these benefits often appear as the rationale for choosing supervision-based solutions. Supervision is a system intervention, not optional support. Staff behavior directly affects client behavior, and supervision shapes how staff implement treatment. Without effective supervision, performance drift is almost inevitable. A common exam trap is viewing supervision as informal or secondary rather than a critical system component. Effective supervisory relationships start with clearly defined roles and expectations. Supervisor-supervisee contracts help establish goals, responsibilities, and boundaries. Ongoing communication and professional boundaries are essential for ethical and effective supervision. Strong supervisory relationships support trust, growth, and performance. Feedback is one of the most powerful tools in supervision. Effective feedback is behavior-specific, timely, and balanced between corrective and positive input. It must be tied to clear performance expectations. On the BCBA exam, remember that feedback itself is a behavior change procedure. Equity in supervision means being aware of bias and ensuring fair access to supervision resources. It requires providing individualized support based on supervisee needs. Cultural responsiveness is a key part of equitable supervision. The exam expects supervisors to adapt their approach rather than using a one-size-fits-all model. Equitable supervision improves staff performance, retention, and morale. It also leads to more consistent service quality and better client outcomes. Providing equitable supervision is an ethical responsibility. A common trap is assuming that equal treatment always means equitable treatment. It doesn't. When selecting supervision goals, BCBAs must consider supervisee skill level, performance deficits, and environmental constraints. Client risk factors also play an important role. Supervision goals should always be purposeful and tied to real performance needs. On the exam, vague or generic goals are rarely correct. Supervision goals must be measurable. They should describe observable staff behavior with clear performance criteria. Goals should link directly to treatment integrity and allow for feasible data collection. Exam tip: goals describe staff behavior, not intentions or attitudes. Performance management strategies include task clarification, modeling, practice opportunities, and feedback with reinforcement. These strategies work together to build and maintain staff performance. The exam often tests whether you select strategies that match the actual performance problem. Think in terms of systems, not isolated actions. Supervision is not the same as training. Training focuses on initial skill acquisition, while supervision focuses on performance maintenance. Reinforcement and feedback are what drive long-term behavior change. A common trap is assuming that training alone will fix motivation issues. Function-based supervision asks why staff behavior is not occurring. Is it a skill deficit, a performance deficit, or an environmental barrier? Supervisors should focus on the function of behavior, not just its form. This mirrors how behavior analysts approach client behavior. Once the function is identified, the supervision strategy must match it. Skill deficits require training and modeling. Performance deficits require reinforcement. Environmental barriers require system changes or support tools like checklists and reminders. Evaluating supervision outcomes is essential. This includes collecting staff performance data, treatment integrity measures, and client outcome data when relevant. Supervision should produce measurable improvements and sustainable change. If outcomes aren't improving, supervision strategies need to be adjusted. Data-based supervision decisions help maintain effective strategies and guide modifications. Avoid reacting to isolated errors or single data points. Make one change at a time and monitor its impact. The exam strongly favors systematic, data-driven decision-making. Supervision is closely tied to ethics. Supervisors must protect client welfare and support staff competence. Professional responsibility and ethical decision-making guide supervision practices. Ethical supervision is not optional. It's a core BCBA duty. Common Section 1 exam traps include treating supervision as informal mentoring and ignoring staff data. Another frequent mistake is confusing training with motivation. Applying client interventions to staff problems is also incorrect. Supervision decisions must always be data-based. Section 1 decision logic follows a clear sequence. First, identify the staff performance problem. Next, analyze the function of that behavior. Then select an appropriate supervision strategy and evaluate outcomes using data. On the BCBA exam, Section 1 appears primarily as scenario-based questions. You'll be asked to respond to staff performance issues and integrity breakdowns. Many questions involve system-level decisions rather than individual interactions. Understanding supervision logic is key to answering these correctly. Section 1 connects supervision to the broader role of the BCBA. Supervision supports treatment integrity, ethical practice, and long-term outcomes. It integrates assessment, intervention, and system management. Without effective supervision, behavior-analytic services cannot be sustained. The key takeaways from Section 1 are simple but powerful. Supervision is behavior analysis applied to staff. Staff behavior is shaped by contingencies and systems. Data and systems thinking guide effective supervision decisions. If you're ready to master Section 1, practice is essential. You need to apply BCBA-style decision logic to real supervision scenarios. To build confidence and exam readiness, try a free full-length BCBA mock exam at www.bcbmockexam.com. Thanks for watching, and we'll see you in the next section.